Sure, abuti honestly.
Foster Mohale, who is the spokesperson for the Department of Health. Foster, thank you so much for joining us. Good evening.
Clement, and good evening to your viewers at home, and thanks for this opportunity.
What's been your position as the Health Department? I know previously you have tried to warn Operation Dudula from continuing with this campaign. From what you observed so far, what's been happening? Are they listening? And what's your next plan as the Department of Health?
Yeah, no, definitely. As the Department of Health, we've discouraged individuals and organized groups like Operation Dudula who go around at our health facilities demanding to see any form of identity from the healthcare user. We discourage that, even though we understand the concerns. So they are raising valid concerns, but through illegal means, which is a challenge. So we understand the burden of created by undocumented foreign nationals on our healthcare system. But we want to encourage anyone with concerns to raise their concerns through a legal means, but also proposing solutions to address this issue on a long term, because we strongly believe that this is a societal issue. It's not only about health. You can imagine the undocumented national or citizens in the country who commit crime. It's going to be difficult for our law enforcement agencies to trace them because they are undocumented. But with regards to access to healthcare, you correctly quoted the constitution of the country, especially Section 27, also supported by the National Health Act and other pieces of legislation, which says we cannot deny anyone access to health purely because of their immigration status or their nationality for a number of reasons. For example, just yesterday, we have issued a media statement to update the public with regards to Mpox, the outbreak of Mpox in the country. And majority of these cases are imported cases, meaning that they were imported from countries' origins where currently they are dealing with the outbreak of this disease. The same applies to COVID-19, the same applies to measles and so forth. And you will never know who is the carrier of which virus. So if we start discriminating against the healthcare users based on their nationality, all our efforts to prevent the spread of these infectious and deadly diseases will be we will not succeed. So hence we say, let's try to address the root cause, which is not health. So let's try to identify the root cause and also deal with that root cause. We'll be able to prevent a lot of the challenges.
Yeah. So when you say that you do understand as the health department the concerns that they're raising, albeit doing so illegally, the issue of foreign nationals and the impact that immigrants have on our healthcare system, do you have that kind of data? Are you able to state that you're aware that there are pockets where particularly illegal immigrants are overburdening the healthcare system?
No, definitely we are well aware. Remember when the Minister of Finance, they allocate the budget. They allocate budget based on the population size of the country, and as the Minister of Health also further allocate the budget to provinces based on the population of the provinces. The same way the MECs, the premiers, the MECs, they also do the same. So I'm just giving an example. Let's say health facilities which are located around Musina, obviously they know the population size which is documented in Home Affairs and also Stats SA, how many people are living in that particular area. So when we allocate the resources, the number of the nurses, the number of other healthcare workers, but also the infrastructure and also the treatment, we allocate based on the size of population so that we are trying to meet the ratio. So unfortunately, you will plan for example, let's say around Musina, the population according to State SA is about 2 million. So obviously, we will plan our resources according to the official size of the population, but we end up seeing influx. We end up saving more healthcare users than the documented one. But because of the laws of the country, we cannot discriminate against anyone.
So what do you say then to someone who, because part of what this group is raising is that you've got some South African citizens who try to go to a clinic, who try to go to a hospital, and sometimes there's just no beds because of that overburdening that you are speaking about. And yes, there's no justification of the actions by this group, but I mean, you surely understand the frustration on the citizens of this country if they go to a hospital or they go to a clinic and they are not able to get assistance there because the system is overburdened by illegal foreigners.
Absolutely correct. That is a fact. But I know at some point previously the government tried to engage the embassies of a number of countries whose citizens are currently in the country to say, please, can you meet us halfway, try to settle some of the bills for some of your citizens? But unfortunately, they asked us the difficult question which could not answer, to say they are not aware of the presence of their citizens because they did not leave their countries legally, meaning that it's going to be difficult for them to account for anyone who claims to come from the country if they are here illegal. So that is a conundrum, but we want to appeal to members of the public, individuals, organized groups, to say, please, let's try to identify the root cause of this instead of dealing with
But we already know the root cause. We do know the root cause. We already know the root cause. So what are we trying to identify? You've just indicated that there are people who are coming into the country illegally. Even their own governments are not able to identify them. When they are here illegally, they end up using our services because our laws and our constitution allow for that. Isn't that where the issue is? So when you say let's identify it, what do you mean?
No, look, I don't think that could be one. Look, firstly, the fact that they entered the country illegally, they committed a crime in the country. Do you agree with me?
Yes,
so
I
meaning
do.
that yes, meaning that the law enforcement agencies must enforce the law and act without a bias. So they need to enforce the law and arrest anyone. So they committed the crime. So they must be arrested and deported. So hence we say, Clement, if you know that your neighbor Foster is here, or you suspect that Foster, your neighbor, is here in the country illegally, what stops you from calling the law enforcement agency? What stops you from calling the immigration officers to come and interrogate Foster? And if I cannot provide any proof that I'm here in the country legally, then I must be deported.
Yeah, and first, I mean, you know how the system in this country is. I bet you there are many people who have probably tried that approach before. And part of the problem, which Home Affairs has admitted to, is the corruption in the system. So yes, you call that immigration officer, but they get given money and they walk away and nothing really happens. And look, I'm not trying to hold you accountable here for issue of our porous borders. Yes. That's not your department. You are the health department. But I'm trying to indicate that as government, you have completely failed to manage the borders, because now we're sitting with a situation where citizens are frustrated because they are unable, some of them, to get healthcare services because our healthcare system is overburdened by illegal immigrants. And all we're hearing is, oh, we need to go fix our borders, which is a promise that's been made for so long. So that's going to make it difficult for you then to have conversations with citizens who are frustrated, because they'll say to you, you've been promising to fix this and you're still not fixing it.
No, definitely. And just to give an example, to say this is a societal issue. Look, someone can also argue that their children are not able to get the space in the local schools because now they have to compete with the children of undocumented foreign parents. So that is, hence I say this is a societal issue that must be dealt with holistically, not in a piecemeal. Exactly, you have pointed one of the contributing factors, the issue of corruption. So if we can try to address the issue of corruption and other contributing factors, definitely this issue will be able to address this issue once and for all.
Is there an expectation that when you are a foreign national or you are here illegally, there's supposed to be some payment of sorts that you have to make when you are getting healthcare, even in public hospitals? Can you clarify that for us? Because part of what we're hearing being reported is that this group sometimes wants to ensure, I don't know how they go about ensuring that, that there's some form of payment that's made at these clinics or these hospitals when it's foreign nationals that are consulting?
Yeah, no, according to the public health system in the country, the healthcare service at the primary level, meaning that at the clinic and community healthcare, is free of charge for anyone, regardless of their regardless of their migration status. Then at the higher level, the hospital level, it is not free for anyone, whether South Africans or whether foreign nationals, except for the following categories: pensioners, number one, number two, pregnant women, number three, children under the age of 5. So it's free for those three categories, but anyone is supposed to pay, and the cost is determined by what we call the means test. So your affordability, we check your affordability, then we're able to charge the price. But you know that the public health sector, our priority is to save lives. Unlike in private sector, where before they can even open a file, you need to put money, you need to show any form of a financial commitment that will be able to afford the healthcare. But in public health sector, we prioritize your health, then we can sort out the issue of settling the bill afterwards. And that's where we find that some of these people are unable to afford not only foreign nationals, but also South Africans because of the level of unemployment.
Yeah. All right. Foster Mohale, let me thank you. He's the spokesperson for the Department of Health.
Ladies and gentlemen, good South Africans, I'm sure by now we can actually see that these laws actually need to be challenged head on and changed so that they actually suit our narrative. What we're actually witnessing right now is an escalation of South Africans, patriots, and saying that we have had enough. We cannot continue to suffer, struggle in our own country. It's time for us to take a stand and fix our own country and not leave like how other foreigners have left their countries, their mess, and have come all the way to South Africa to try and exploit our very own resources. In short, ladies and gentlemen, is that now it is seeming that things are beginning to escalate, where South Africans are saying, we will keep quiet no more. We have already kept quiet for way too long, and we've seen foreigners continue to come in numbers to our country, continue to come in thousands to our country, and now we are finding a lot of things difficult, even some places being super crowded by legal foreigners. Is that the country that we want for ourselves? We don't want that kind of a country for ourselves, because if you allow a foreigner to overpower you in your very own country, to be more than you in your very own country, tomorrow you will not be able to even stop them should they demand a regime change because of the numbers. So South Africans, we cannot allow this to continue happening in the spirit of Africanism. What is that? We are ideally not a Pan-Africanist country, so we cannot subscribe to Pan-Africanism values. So we can't cater for the whole nation. We want to only cater for our South Africans. And I like how this gentleman calmly even describes the difficulties that they are facing. The difficulties that they're facing, and that these people are criminals that shouldn't even be here in this country. But because of the weaknesses of our laws and of our law enforcement system authorities, immigration, there's a big failure to actually address the root of this at the core. And saying that you need to find the root cause of all this is actually misguided, because in all reality is that we know where all of this is stemming from. That is why we need to fight it head on. But what we've actually come to realization is that you can't hold this guy who's talking here actually at fault, because he's singing for his supper. He's just saying all of this because he's employed. He's not a politician. People we need to hold accountable are the politicians who came to our houses saying that vote for us, vote for us, vote for us. We have your best interest at heart. And now South Africans are speaking that our best interest is actually changing these laws and constitution, because we do not want to be sharing with Africans, especially if they cannot be paid. And if they can pay, which means they can go to public hospitals, public clinics, private doctors, where they can actually pay at private institutions of medical practice. That has been said many times. Other than that, it means they are not doing things properly, because all other countries, wherever you go, you have to pay and show that you've got medical insurance should you need a certain level of help that is within the medical field. But why are South Africans or people coming here to South Africa actually being allowed to go scot-free from this? How is this? So we really need to now continue pushing this fight. It can never get laid to slumber or be forgiven and say that the fight is over. The fight will never stop, and we should continue to support such initiatives. This is our way of saying to this government that has kept telling us or giving us big FUs that this is not the time. Now on Spizani, we want our country back. We want laws to be enforced in this country, because now they haven't been enforced for a very, very long time. Just a lawless country, and it can't be right. Well, I'd like to hear what you've got to say about this, because this has to be continued to be kept on our tongues so that they can see that this is not going to go away anytime soon. Especially the president. If he's never come and actually spoken to the citizens and said, I'm looking into this that I know you guys are in distress of. And I'd like to thank you, South Africans. Please do like, share, subscribe.
Sure, I would do honestly.